Gunshot wounds are a serious public health issue, affecting thousands of individuals each year. They cause devastating injuries that can have long-term consequences for victims and their families, often altering lives forever. Understanding the impact of these wounds is crucial in providing effective medical care and advocating for prevention measures, which can help reduce the incidence and severity of such injuries. This essay explores the journey of a bullet from the moment it leaves the gun to the long road to recovery, shedding light on the physical and emotional toll of this form of trauma, which can be overwhelming for both the victim and their loved ones. The human body, while resilient, is incredibly vulnerable to the force of a projectile, which can cause extensive damage. When a bullet penetrates the skin, it sets off a chain reaction of damage, affecting tissues, organs, and sometimes even bones. The extent of the injury depends on various factors, including the type of gun, the bullet's velocity, and the location of the wound, as well as the angle of entry and the distance from which the shot was fired. Every gunshot wound is unique, presenting its own set of challenges for medical professionals who must quickly assess and address the specific needs of each patient. However, a common thread binds them all: the need for immediate and comprehensive care to save lives and minimize long-term disability, ensuring the best possible outcomes for those affected. The journey of a bullet begins in the chamber of a firearm, a place where precision engineering meets raw power. When the trigger is pulled, the firing pin strikes the primer, igniting the gunpowder within the cartridge, a process that happens in mere milliseconds. This ignition creates a rapid expansion of gas, propelling the bullet out of the barrel at an alarming speed, a speed that can be mesmerizing when seen in slow motion. The speed varies depending on the type of gun and ammunition used, but it can reach thousands of feet per second, a testament to the power contained in such a small object. This immense velocity gives the bullet its destructive power, capable of penetrating various materials with ease. As it travels through the air, the bullet carries kinetic energy, a force that is both fascinating and formidable. Upon impact, this energy is transferred to the target, in this case the human body, causing significant damage. The higher the velocity, the greater the energy transfer, and the more extensive the damage, a principle that underscores the importance of bullet speed. The bullet's shape and composition also play a crucial role in the severity of the wound, influencing how the energy is distributed. Some bullets are designed to expand upon impact, creating a larger cavity within the body and causing more tissue damage, a feature often used in hunting and self-defense. Others might fragment, sending smaller pieces ricocheting through organs and tissues, leaving a wider path of destruction, a devastating effect that can be life-threatening. The moment a bullet pierces the skin, it creates an entry wound. This wound is often small and clean-cut, especially if the bullet is traveling at high velocity. However, beneath the surface, a cascade of trauma is already underway. The bullet's kinetic energy is transferred to the surrounding tissues, causing them to stretch, tear, and compress. This creates a shock wave that can extend far beyond the bullet's path, damaging blood vessels, nerves, and organs that are not directly hit. The body's immediate response to this trauma is to constrict blood vessels in an attempt to control bleeding. However, this can also deprive surrounding tissues of oxygen, leading to further damage. The body also releases inflammatory chemicals which contribute to swelling and pain. As the bullet continues its journey through the body, it leaves a path of destruction in its wake, tearing through tissues and organs with relentless force. The specific damage depends on the bullet's trajectory and the structures it encounters, which can vary greatly depending on the angle and speed of the bullet. Muscles are often the first tissues to be damaged, absorbing the initial impact and energy of the bullet. The bullet can tear through muscle fibers, causing significant pain, bleeding, and loss of function, which can severely impact mobility. If a major artery or vein is severed, it can lead to life-threatening internal bleeding, which requires immediate medical attention to prevent fatal outcomes. Bones pose a greater challenge for the bullet, often slowing it down, but not necessarily stopping it. Depending on the bullet's velocity and the angle of impact, it might shatter the bone, creating multiple fragments that can cause further damage to surrounding tissues, complicating the injury. Organs are particularly vulnerable to gunshot wounds due to their delicate structures and essential functions. The liver, spleen, and intestines are highly vascularized, meaning they have a rich blood supply, which makes them prone to severe bleeding. Damage to these organs can result in massive blood loss and organ failure, leading to critical conditions that require urgent medical intervention to save the patient's life. Section 5. The Golden Hour, Immediate Response to Gunshot Wounds. The first hour after a gunshot wound is critical. This period, often referred to as the golden hour, can mean the difference between life and death. Immediate medical attention is crucial to stabilize the victim and address life-threatening injuries. The initial response usually involves controlling bleeding, ensuring an open airway, and providing oxygen. If the victim is conscious, pain management is also essential. Paramedics often perform these life-saving measures on scene before transporting the victim to the hospital. Once at the hospital, the trauma team takes over, conducting a thorough assessment to determine the extent of the injuries and develop a treatment plan. Section 6. Surgical Interventions, Repairing the Damage. Surgery is often necessary to repair the damage caused by a gunshot wound. The type and extent of surgery depend on the location and severity of the injury. In some cases, surgeons may need to remove damaged tissues or organs. They may also need to repair damaged blood vessels, nerves, and bones. Reconstructive surgery might be required to restore function and minimize disfigurement. Advances in surgical techniques and technology have significantly improved the outcomes of gunshot wound victims. However, surgery is only one step in the long road to recovery. Section 7. The Long Road Ahead, Rehabilitation and Physical Therapy. Recovering from a gunshot wound is a long and arduous process. It often involves a combination of physical therapy, occupational therapy, and psychological counseling. Physical therapy focuses on restoring strength, flexibility, and range of motion. Occupational therapy helps patients regain their ability to perform everyday tasks, such as dressing, bathing, and cooking. Psychological counseling addresses the emotional and mental toll of the injury. The recovery process can take months, even years, depending on the severity of the wound. Patients often face physical limitations, chronic pain, and emotional distress. Section 8. Psychological Scars, the Invisible Wounds. While physical injuries are often the most visible consequence of a gunshot wound, the psychological impact can be just as debilitating. Many victims experience post-traumatic stress disorder, anxiety, depression, and survivor's guilt. These invisible wounds can manifest in various ways, including flashbacks, nightmares, difficulty sleeping, irritability, and social withdrawal. They can significantly impact a person's quality of life and ability to function in daily activities. Addressing these psychological scars is crucial for holistic recovery. Mental health professionals play a vital role in providing counseling, therapy, and support to help victims cope with the emotional trauma. Section 9. The Long-Term Impact of Gunshot Wounds. The long-term impact of gunshot wounds can be far-reaching, affecting not only the victim but also their families and communities. Many survivors live with chronic pain, disability, and the need for ongoing medical care. The financial burden of medical expenses, lost wages, and rehabilitation can be overwhelming. Some victims may require assistive devices or home modifications to accommodate their disabilities. Moreover, gunshot wounds can have a ripple effect on families, causing emotional distress, financial strain, and social isolation. The impact on communities can be felt through increased healthcare costs, lost productivity, and a sense of fear and insecurity. Section 10. The Importance of Gun Safety and Violence Prevention. Gunshot wounds are a preventable public health crisis. By promoting gun safety measures and implementing effective violence prevention strategies, we can significantly reduce the number of lives lost and forever altered by gun violence. This includes promoting responsible gun ownership, such as safe storage practices and background checks. It also involves addressing the root causes of gun violence, such as poverty, lack of opportunity, and mental health issues. Creating a culture of peace requires a multifaceted approach that involves individuals, communities, and policymakers working together to create a safer and more just society. Section 11. A Call for Change Reducing Gun Violence. Gun violence is a complex issue with no easy solutions. However, understanding the devastating impact of gunshot wounds is an important step toward finding solutions. By raising awareness, supporting research, and advocating for change, we can work towards a future where gun violence is no longer a public health threat. This includes supporting organizations working to prevent gun violence, advocating for stricter gun control laws, and promoting conflict resolution and de-escalation training. It also means fostering a culture of empathy and understanding, where differences are resolved peacefully and respectfully. Each of us has a role to play in creating a safer world. By working together, we can make a difference and prevent future tragedies from occurring.